Hilda Sánchez has been quietly doing some of the most important work at Beond since she joined the team. She came from traditional hospital medicine, the kind of environment where your job is to intervene, stabilize, and move to the next patient. And then she walked into a psychedelic treatment center and everything she knew about nursing got turned inside out. Today we're talking about what it actually looks like to keep someone safe at Beond, and that starts long before anyone gets into a treatment room. From the moment a guest is medically approved through arrival, pre-treatment assessment, the treatment itself, and every hour of their stay after, safety is the thread running through all of it. We're getting into what's in the room, who's there, what we're watching for, how we train, and how our protocols have evolved over several thousand treatments. We're also talking about flood dosing versus fractional dosing, and why what we're seeing with fractional is genuinely exciting. But honestly, what I love most about this conversation is Hilda herself. The way she talks about the guests she supported along the way, what that accumulation does to you over time, and how it's helped her grow as a practitioner, and what it means to be part of a team that grows together inside this work. This one is for anyone who has ever wondered, is Ibogaine really safe? Hilda is your answer. Hilda, it's so wonderful to have you on Ibogaine Uncovered. You've been a nurse here at Beond for 3 years. You're now a lead nurse here, and I thought it would be valuable to have you on to share, especially now given like the executive order, all the interest in Ibogaine, to really share more about our medical safety, our protocols, what emotional safety looks like, and, structure. I think with structure is safety. So to have you on and just to hear more about your background and get into the work that we do here. So how did you become a nurse? Why did you become a nurse in the first place?
Well, that's a really good question. First of all, thank you for inviting me. I feel an honor to be here and to share part of my story here at Beond and what I've been witnessing these 3 years. What led me to become a nurse was my cousin Marcelo. He has very deep autism. So when I was in high school, I started working with kids with autism. So I learned a lot about care, about understanding the other. The world could be very different from them for them. The noises, the stimulus, the sounds, everything. So I was very interesting in the world of caring. And I found a scholarship back in Puebla, and I started my bachelor's degree there.
So you were inspired because of your own family.
Correct.
And that helped you to want to become a nurse.
Yes.
And it sounds like, there's a lot of empathy.
Yeah.
That is part of nursing, and to work with, autism as well. I think there's a lot of probably similarities in some of the level of care and sensitivity that goes into treating all different types of, we say guests, not patients here at Beond. So, So tell us a little bit about your professional life as a nurse before coming to work here at Beond, and what led you to get a job here in a psychedelic healing center. Were you working in hospitals, and what part of the hospital?
My first job was at a hospital in Tulum, a private hospital. So I worked there a lot in the ER. We see a lot there in Tulum, as you can imagine. My journey as a nurse began there, and I started getting a lot of experience training with people in a very emergency situations. Then I moved to Nayarit. I work at a different hospital there, also a private one. Also on the ER and a lot of the OR too. Then I moved back to Puebla with my mom, and there I work in different hospitals too. Puebla, it's a difficult state on nursing matter because of salaries and how they work. And I came to Beond actually for my human connections, my friends from college that we built a very strong bond. And they came here first. Also, Patty, the VP, she studied in the same college as me. So I know her from Puebla. And these human connections bring me to here. I was in a very bad place emotionally. and professional when I received this opportunity to work to Beond, and I changed my life by choosing that. Like working in a hospital it's something that you've been teaching from college. The system is already built, that it's already done. That you go to a hospital, you have around 6 patients, and anything can happen, and you are always on a rush, and you need to deliver meds and clean patients and do this and follow doctor's orders and all of that. And when I came here to Beond, I start to see nursing very different. What we do is very powerful. We touch people's life in a hospital and here at Beond.
So talk a little bit about what surprised you here. What's different? What did traditional nursing not prepare you for? And what was it like when you first started working here at Beond?
It was shocking. Like, I came from a public hospital. My last job was a public hospital in Puebla, and then I came here. So the contrasts are very, very big. What I've learned here most is listening to the client's story and how that matter. Like everyone here, every client, and even the staff, we are all in a personal journey, and Beond calls people. And people that are here have very, like, the process they have, how they arrive, how they leave, like witness that has changed the whole picture of nursing, and how all that we do here matters. Like even the smallest thing, even saying hello to someone can change something.
So you really see the cause and effect here.
Yeah.
Whereas in a hospital, I can imagine, like, I've been to ERs a few times. I've, had my grandmother passed away. I went to the ER. I've, had to help my father who's sick and who has late stage Parkinson's in the ER. You don't see a lot of change there. People come in and out, but you don't really get to witness the transformation of the human spirit.
Yeah, and in the hospital, they just go. They go because there's something that they need to fix, and you don't see the outcome of that, or even your small interactions with them. But here at Beond, you clearly see the transformation.
So how did you unlearn what you've been learning for years? You've been here now 3 years?
Yes.
Tell me a little bit what that shock was like, and how did you unlearn? What was the hardest part about that?
Actually, yeah, like unlearn the things on how hospitals roll. You're always on a rush, and you don't ask the client or the patient in the hospital. You don't ask them, like, you want this, or you don't take the time. And here we do. We sit with the client, we listen to them, we try to understand where they are, what they need. I mean, it's a collaboration with the guests too, because we need their feedback, in order for us to fulfill the needs they have. But what is like very different is that for me, like, actually listen to the client, commit with them, help them with the process, because we never left them alone. They always have a nurse with them assigned day or night. So if they need anything at 3 p.m. or 3 a.m., they're going to have someone.
And what does that do for you? How does that change you as a human being?
Well, a lot. I think since I started working at Beond, I opened a door on myself to also have my own healing journey. Even that I haven't sit with Ibogaine yet, but I'm on the waiting list, and I'm on my process too.
We have a long waiting list,
yes.
Unfortunately. And people, staff members do Ibogaine. A lot of them have, but it's been so busy lately. There's not always space.
Yeah, so, and with the nursing team especially, it's hard to take one nurse away on all this, because to fill the space, and we need nurses to take care of nurses too.
How many nurses do we have now?
I think we're at 32.
32 nurses.
Yeah.
Have you seen it change the nurses as well, like over time from when they arrive to, months and years later?
Yeah, a lot, especially nurses that they already have work at hospitals and then they work here. You can see the transformation. The new nurses, we are like shaping them like beyond shape. So it's beautiful to see people that is their first job and they are aligning so well to how we want to do things.
I can think of one nurse who I really love. I won't name his name because I don't want to speak about him without his permission, but he started with us in the beginning almost 5 years ago. He came in, he had a lot of fear, very sweet guy, was on a lot of medication, SSRIs and other things,
Yeah.
which is fine, not to knock that, but he wasn't really connected to his emotions and wasn't happy,
Yeah.
And I watched over time how him working with so many clients, sitting in the treatment room, supporting clients when they arrived, really listening. He stopped taking SSRIs. He did Ibogaine, which sometimes people use to reset from SSRIs.
Yeah.
And then he ended up like moving into a Buddhist convent locally, and he showed up, with these Buddhist prayer beads, and now his favorite thing to do is sit in the treatment room. Of course, we always have a few nurses in the treatment room, and watch the monitor and connect with patients with his beads and meditate. He meditates with them during their
and hold their
treatment,
hands,
which I think is so beautiful.
It is. It's a very special moment to be at the treatment room. As a nurse, we try to also be very professional on that, and we have nurses high prepared for that moment that we seem in like a very special moment when they are on the medicine and connecting with the clients that way, what they need. Some people don't want to be touched, some people need that company, so you learn to read that in the treatment room. So
can you share a little bit about training, for example? What happens when a nurse decides to become a nurse and we hire them here at Beond? What are the different certifications and trainings? How do they learn over time to work with, because we have coaches there and therapists, of course, as well, but the nurse's role is somewhat similar to a coach. What is the training like? And what types of trainings?
Well, the first one that we always talk about is the ACLS certification. It's for the Advanced Cardiological Life Support. So we have training nurses to read AKGs and to know when something is maybe going on a way that we don't want. And so that's the first one, and it's around safety, on the medical safety.
Because as some people may or may not know, Ibogaine has cardiac risks.
Yes, correct.
So that's a very important training.
So we have that.
And what happens if someone, for example, has bradycardia or
during the Ibogaine? Then we always have them on the monitor. So you are seeing the heartbeat and the AKG on real time. So the nurses start looking at the heart rate maybe going down, and they start by radio calling the doctor, like we're seeing this. And we approach the client to see how he feels, if he's starting with maybe sometimes that's the point where medicine is kicking in, and they sometimes they just like tell you like, oh yeah, start to feel the medicine, and you can see the heart rate like responding to that verbal
that's very
stimulus.
common because Ibogaine lowers the heart rate, so that's not rare, but our team is
we
trained.
go step by step.
And there's always how many people in the treatment, how many nurses?
Well, if we have 1 or 2 clients on the flood dose, there's 1 nurse, but if we have 3, you're going to have 2 nurses there.
So please continue talking about the certifications.
So we have the ACLS and the trip sitting, and we also train the nurses on trauma care inform. We have a nurse actually that it's one nurse that is in charge of all the clinical process that we have to put that Beond label on the trauma informed care. Like if we're going to do an AKG, we walk through the process, we give them privacy, because they need to have the chest clear. So we try to, let's say, if we have a female guest, we put a female nurse with them. And if it's a male, we put a male nurse. We also have process on the IVs and lab blood work, that if we have some people with some needle phobia, so we also build a process on that, and we can, I don't know, like put some diffuser with some oil scents and music, relaxing music in a place where they feel comfortable. We walk through the process. We ask the client, what do you prefer? How do you want us to proceed with this? Do you want us to count, like you're going to receive the pinch, or do you prefer not to know, or someone holding your hand, or maybe someone talking to the beaches here at Cancun, or, like
You asked them before, I'm not a medical professional. I'm an entrepreneur and I sort of stay out of the clinical side. But what's been really cool to see over time is how our protocols, our medical protocols, both for physical safety but emotional safety, have evolved.
Yeah.
So it made me think about how, like, the day before the Ibogaine treatment, there are these really beautiful forms that our clients fill out, our guests fill out, around where they do and do not want to be touched, how they want to be woken up in the morning of their treatments, how they want to be talked to. I mean, our protocols have evolved over time, and we've learned through thousands of guests now what works and what doesn't.
Yeah, well, these 3 years that I've been working here, I've also see this process of growth at Beond with safety protocols, and how we learn, we build, we put it on action, and we can see how it's working, like that. Like the welcoming process before they coming to Beond, we prepare all the departments here know what to do.
Let's talk a little bit about the welcoming process, starting from before guests arrive. So at Beond, there's a pre-admissions team, and there's a whole process where people fill out a form online. They speak to one of our Ibogaine experts. They decide whether or not this is the right choice for them. If it is, all the questions are answered that guests have. If it is, there's a medical consult after. There's the HIPAA compliant form that's filled out. They then speak with a doctor around, safety, and if there's any contraindications or medication they need to get off of, or maybe there's cardiac issues or a history of seizures and they can't come. Once they're medically approved, then they start coaching remotely, and they start preparing. What happens the day before arrival with your team of how does medical on-site get involved at that point, and what happens for the client all the way up until their actual treatment on-site?
On-site, the team prepares 1 day before of the arrival. We read the client's application. We know how they're going to come, and see and try to accommodate it on the rooms, the nurses that is going to assign for the welcoming, and we prepare for that. And when they arrived, we prepare a welcoming room. That is this one of those. The nurse already have everything ready. They welcome them. They offer something to drink. They talk to them about the welcoming process, what needs to be done. We also open the door to let them know if we understand sometimes arriving to a different country, the Mexican people like doing something that maybe they are not quite well known, it seems a lot. So we also offer the client at any time if they need to take a break, if they want to eat first or anything, we go by day piece.
Before they have the medical consult, when they arrive, and the check-in with the filling out forms.
Correct. Sign the consents, doing the EKGs,
labs,
UDT.
There's like a welcoming process that people have explained to be very, and it infuses hospitality.
Yeah. Could feel also invasive. We need to check belongings. Again, this is around safety. We need to make sure that everything that the client have or will have with them is not harm or medication. We have nurses here that even if you arrive to Beond and you are on medication for high blood pressure that has been approved by the doctors, the nursing team take those medications and we provide the medication as the client let us know how they take it.
And
so
then
they
it's
don't
administered
lose.
to them.
Yes, correct. So nursing will keep some things, especially medication, but we are going to provide their medication as long as they are approved. But yeah, so they don't have to worry about timing of medication. Nurses will be on top of that.
And then how is the treatment? Talk a little bit about customization and planning for the Ibogaine, because it doesn't happen, of course, the first day you arrive. There's a lot of therapeutic support and coaching and, somatic care and other things. Yeah, share a little bit about that.
Well, I think, and I share this to every guest that arrives, I think Beond moves through safety. We need always to make sure that everything will be safety clinically, safety emotionally, safety physically, like everything that we take that very seriously. So that's like our first step. So when a client arrives and we notice something on the AKG, the doctor will let us know. We prepare a consult with the specialist that is a cardiologist that will arrive to Beond. We will do proper tests and depending on the results, we can see if the client can do a flood dose or maybe a fractional dose, or like we can personalize the treatment for the needs of each client depending on the program, if it's chemical dependency, if it's more than trauma. Also, like listening to the client, what's the root of their being here, like what do you want to work,
what are your goals?
Yeah,
how can we work together?
Yeah. And then along with the coaching team and nursing team and this nurse that is the specialist on the trauma caring form, on how we can navigate some things. I mean, there's always challenging process for every individual. Some process are like very smooth for some, but it could be very triggering for others. So we try to navigate on the specific needs of every guest. And so, yeah, if we notice some things, or some people can be afraid to do a flood dose, it could sound also like a lot. And
yeah, that's I don't even like the name flood dose because it sounds like it's happening to you against your own consent and all at once.
Yeah.
A flood dose has been used throughout the history of Ibogaine treatment in the U.S.
Yeah,
I think for the last 50 years as this very strong, it's a lot of medicine. And what we've learned here at Beond, and you can share more, is that it's not for everybody. Some people are very sensitive. So we now have innovated actually and started, there's an option for fractional dosing, which is smaller dosing. In the end, you end up getting just as much and actually more
sometimes
medicine, but you do smaller doses over multiple days with a couple days off between. Yeah, share a little bit about that and who that's for and how do you see that helping people maybe just as much or maybe even more than the flood dose? Who's it for, fractional dosing, and who's flood dosing for, and what have you noticed?
Well, in general, the flood doses were built for our beach house program. It lowers the risk, and they have these benefits of the medicine anyway. So we've been noticed also that for some people that arrive to Beond that may have some risk, let's say.
Can you explain a little bit more about risk? You said lowers the risk, and then about the benefits.
So on the fractional doses, because it's a lower dose than the flood dose, the risk on the Ibogaine with the heart of the guest is lower. You can the changes on the AKG that you can see are lower. Some have some bradycardia. It depends on each individual too, but the risks are lower on the cardiological matter. And also But they also have the psychedelic effect. They also have the neuroplasticity. They also have these emotions happening, you know?
Yeah, you would think because it's not a flood dose that they wouldn't get the same benefits. But
Yeah.
what's been surprising now to learn with, I don't know, probably more than 100 guests,
Yes.
is that the fractional doses build on each other. People have visions, which, the psychological piece of looking at their past or having insights occurs,
Yeah.
and they get the same, because we have a research team here as well, and we've studied now long term, they're
Yeah.
getting the same neuroplastic benefits over
Yes.
time as the actual flood dose. And I've actually heard from a lot of people that the fractional dose is a faster recovery. I've heard from guests who come back. They did a flood dose maybe a few years ago, and now they come back.
For the
They stay
fractional.
at the beach house and they do fractional dosing. They said they've actually had more insights, and it's a quicker recovery. Like with a flood dose, you can't sleep very well that night. It's really intense all at once. The fractional is still intense, but it's slower. It builds over 3 or 4 days, right?
Yeah.
Because you're doing multiple doses.
Yeah.
And you can recover between quicker, have almost more coaching insights because you're more grounded, maybe. So yeah, how, if someone comes here and is interested in doing a fractional, how is that decision made? Is that a decision that the person would make with the nursing team and the doctors together?
The guests can always let us know what they are looking for, what they want, so but normally the fractional doses are like assigned since the consult with the doctor remotely, depending also on age, if they have some cardiological risk itself, like the person, not because of the medicine, but because they have something in the past or something like that we know it could be risk. So we sometimes from the beginning we know they come from fractionals, even though they're not at the beach house. They can be regular population, like in the White House greenhouse,
In the main Beond.
yeah, in the main Beond, and we can know that they already have scheduled the fractional doses because of that, some risk or maybe the age. But also if the guests arrive and they know we have this possibility of fractional, and they express themselves like, I will prefer to have fractional doses, and we can build the program for them.
Yeah, a woman was here the other day and she decided to switch from the flood dose. And she worked with the medical team for approval because she's very sensitive to others.
Yeah.
She had done other psychedelics in the past. So she chose not to do a flood and to do fractional dosing instead. And she said it was the most profound experience of her life. And she's worked with many other all of the psychedelics, but she knew that she was sensitive and wanted to go slower. It's kind of like, I explained the flood like doing a cannonball versus slowly getting into the water. Both get into the water in the end and splash around. Actually, it might be a good metaphor. They dive deep and explore, and it can be fun or not so fun, I guess. But they're both getting in the water. It's just different ways of getting in, maybe. All right. Well, thanks for explaining that. So then the day of the treatment, can you share a little bit more about the protocols in the morning that the nursing team has continued to evolve upon with the doctors, of course?
Well, as you say before, one day before the treatment, we ask some questions to know how they want to proceed on the whole day of the treatment, beginning on what time they want to be waking up. If they want us to wake them up with a hot tea or with something specific. If they want some specific smells on the treatment room. If they want to print some pictures and we place them on right on the bed. If they have some totems that they want to have with them. When they're going to be out of the treatment room, we offer some food. It could be like some broth or maybe something that they think they may want. That changed because sometimes they leave the treatment room. They're like, I don't want to eat, or I prefer to eat something else, or
Right.
I'm very
Ibogaine's a
hungry.
stimulant. You might not want
Yeah.
to eat. I remember when I did Ibogaine at Beond with our team, I really wanted sushi at the end.
Yeah.
So then the team
Yeah, yeah,
ordered
yeah.
sushi at late at night, and that was I liked it. But yeah.
Yeah, so we always try to ask them what they want, but we also understand that can change at the end. But we try to be ready, when they're gonna be out of treatment room, we let kitchen know so they start preparing the plate that they already ordered. We ask the client if they want it or if they prefer other things. We also ask them how they want to be watched during the night, if they want the nurse to be every hour, or if they want to be alone, just if they call the nurse to go see them. There are some clients that said, I don't want to spend the night alone, so we ask the nurses to take shifts to be with them during the night. So we listen, we try to accommodate their needs, and yeah.
So trauma-informed care and the training that our nurses undergo, talk a little bit about, you're sharing about how to really empathize and listen to each person's needs and how to customize and also realize that desires change from guests and clients. What is it like to be present with someone during the treatment? Like, not just monitoring their vitals, but to really be with somebody. Let's say they're having trouble or something challenging comes up. What is that? How do we work with that?
Well, if they're on treatment room, the nurse that is assigned there will approach the client. Also, we can let them know we're here if they need to. Some client ask for just hold my hand and be here. Some others are asking for a coaching, so we have always coaching on site. And if we need a coach to go to the treatment room and talk to the client and maybe help them navigate the challenging part, then we do. Sometimes the nurse can help them navigate, but we also have the backup of the coaching, and they can come. We also have coaching on call during the night, so if something happened even the same night of their flood dose, that can be also very challenging of the emotions and feelings. We also have that. So if it's needed, we will call the coach and they arrive. So we have the training nurses on trip sitting. We also have some nurses that are studying some psychology. So we have a very strong team, I think, between coaches and nurses that work together with the clients. And we know when maybe as a nurse, maybe this is something that I cannot complete with the client, so I need the coach here with me or with the client to help that part.
Can you talk to me a little bit about structure? So we have rigorous clinical protocols given the cardiac risk with Ibogaine, but structure is not the opposite of warmth. Why is structure the thing that allows the guest to let go?
Well, I would say our protocols at first were built on only clinical, but along the way we noticed the importance of put the trauma care informed there in order for the clients know what we're doing, what we need. Um, and so one of the biggest safety protocols on the welcoming part, for example, when they are arriving, is of course the AKG, also the UDT results, because some substances can change also the beats of the heart or anything. So we will know if we need a little more time for them to be off those medications and in a more safety way to sit with the medicine.
A lot of people, it's normal that there's a fear of letting go. That might be one of the biggest fears around Ibogaine.
Yeah, and we notice some guests that are that way, and we try to also give them choices. Like we need to do this, but we can do it this way or this way.
Here's some options.
Yeah.
So they still have, there's an element of choice, of course. It's not rigid. Like my experience with Western medicine, and of course it saved many lives, I'm not going to knock it, but it can be, this is what, sort of a top down from a doctor who knows everything. This is what you're going to do for this specific situation. There's not a lot of choice.
Yeah, like regular medicine is that way. This is the way, and you just take the medication and go home. And what we try to build here is first the clinical team to be able to listen, to understand, and to try to accommodate on our protocols. So we have protocols because we know that bring us safety, and for specifically the guest, but also for the team, to work in an environment that you don't feel like anything could happen any minute, but we also know that we don't have to be very rigid on our protocols in a matter that we need to do the AKG, but if you don't want to do it right now, or if you don't want this nurse, or if you want to maybe do it in a specific room.
Or you're a woman and you only want female nurses. That happens often given trauma, that women have who come. So then we arrange only female nurses in the room the whole time.
Yes.
Which I think is really cool. Or, how do you want to wake up in the morning? The day. What's the weirdest or craziest request that you've gotten for how you want to be woken up? Can you think of anything?
Well, right now I can remember like one, but yeah, there are some guests that they want to be waking up by music sometimes,
Like specific music?
Yeah, like specific song. No, they're beautiful songs, and there's our special song for the guest, but it's odd, like maybe the nurse with the little speaker entering the room, like, what? Good morning.
It's it's beautiful though too. It's the morning of their big transformation with Ibogaine. They're being woken up with the music, that like a parade of love.
Yeah.
And, then led to, there's also, I think, if you could share a little bit about what you don't get in hospitals is spiritual aspect, right? People come all different religions. Some people don't have religions. Like we are not a religious place, but the work of transformation or personal growth is very spiritual. What has it been like to work in a place with your team of nurses and bring in spiritual rituals? Like some of our nurses, you're ushering people through basically these rebirths.
Yeah.
Can you share a little bit about how has that changed you?
Yeah, it's changed me a lot to also understand other people's beliefs, and to also treat this moment as something very spiritual and special, like a ceremony, like a rebirth. But I think, personally, it no matter what religious you are, and we respect if people don't want to do the cleansing or the candle or things like that.
It's a choice. Some people don't want the cleansing.
It's perfect.
The candle intention painting, which is not religious. It's more about, painting.
I actually think of, personally, I think it's like the ceremony for the Ibogaine. It's the ceremony for myself, for opening my heart, for seeing my spirituality, no matter what I want to believe or what I believe, or it's opening the healing,
But at the end of the day, it's not for everyone. So if people don't want to do it, it's like no judgment. Great.
No, not at all. No, we understand, we respect, and we try to, even if they have something specific that they would like to do before entering the treatment room. We built our ceremony, but if people said, I want this instead, there are some people that I just want to be on the yard 20 minutes meditating. Okay, let's do this.
That's so great that it's so customizable that way.
Mm-hmm.
So it's the morning of the treatment with Ibogaine. Walk us through the treatment room. What does it actually look like in there?
Like in the morning, the nurses prepare the guest, AKG, UDT, IV, blood sample. We do the ceremony, the candle, and then we move to the treatment room. The treatment room is a space that has a very low light, some music, some projectors. We place the beds. We prepare the beds for a specific client with the pictures if they have thought
Pictures
themes,
of themselves or their kids,
their
if they
kids,
have
their
them,
family,
their
their
parents,
pets. Yeah,
loved ones that are gone. Okay.
yeah. Some others have some letters from the loved ones. Things that are special to them. So they know what bed is set for them because they see, like everything is ready on the bed. We ask them if before getting into the bed they want to go to the bathroom because they're going to be with the heart monitor, the BP, the oximeter, the IV. So there's going to be cables happening. But we also explain them if you want to go to the bathroom, give us a minute to take everything off and help you get up and go to the bathroom.
During the treatment?
Yeah.
How do people, the monitors, the IVs, that can be probably distracting or uncomfortable. How do you work with people through that?
Well, again, every guest that comes to Beond is explained that we move through safety and that is needed. And we understand that it could be a lot, like being on a hospital bed with all the monitors. But we also place them some eye mask, headphones with noise canceling. Ibogaine itself also like open up all the senses, especially the hearing. So sometimes even with that, they can hear sometimes the nurse typing,
Even with
or
the play, we have curated music and
yes,
playlists they can
yes,
hear because
but
they're more acutely sensitive.
Yeah, correct. So there's actually a story of a nurse that a client answering something that she was thinking.
Wow.
Something like, things like that can happen. I mean, they're become very sensitive.
Yes. One survey question our research team just added, we give a lot of surveys and questions. We're learning. We use our research here at Beond and the surveys to improve our protocols mostly. It's not so much to publish outside, and maybe we will publish more because there's a lot of great data, but it's more to inform our protocols and to continue to improve as we're collecting survey data. But a recent survey question that I added was about how, if the person could see
through the eye mask
with their eyes closed.
Yeah.
And we're seeing a lot of data that, and I've heard for years, and myself included when I've worked with Ibogaine, can see the room, through the eye mask, or even predict like when the nurse or the doctor is going to work before it happens. So it's crazy that someone could think for the nurse and answer, like the telepathy that happens. Is really cool. And so that's interesting. And then what related to like technology and medical safety besides can you share a little about what's in the room, what's ready if there is an adverse event?
Of course, we have the I'm not quite sure how to say this in English, but we have the like a
crash cart.
Thank you. With everything, all the equipment that we need. We have a DEA also. I mean, they are on the monitor, but we have first the nurses that are prepared to notice before something can go wrong. And all the team, we have protocols on that to activate, and the team will go to the treatment room. Everyone will be on their positions just to see. And if normally, and like actually for the last 2-3 years, nothing has like happened. And I think it's because we build the protocols from the beginning, not only on the treatment room, not only for that day, but we prepare.
You mean there's constant training, like for code blues and?
Yes, we have the training for that, the code blue. We have a white code that is specifically for assistance at the treatment room. That could not be related to code blue, but something like mind bradycardia, or the client wants to get up to the bathroom, but they are very ataxic. So we need another person to help us, or sometimes they can on the bathroom, they feel like they can do it alone. The nurse is there, but things can happen. They can, I don't know, like trip or something. So we are prepared or any specific situation.
There's a lot of protocols.
Yes.
That's what I've noticed. I'm not a medical professional. I'm like, wow, we have a lot of protocols.
Yes.
They constantly are evolving, and there's
Yes.
new ones all the time. And
Yes.
it's like, okay.
They've been updated. We noticed that maybe this is working, but maybe right now it's not working anymore. So we need to change it, or we need
Adapt
to
it.
add. Yes.
Yeah. Thank you for sharing that. I think a lot of people are wondering,
Yes.
you know.
No, I know this is like traveling to Mexico, like jumping into doing this adventure could be overwhelming. It could be a lot. And we understand that. And what I would like to share here is that we have the heart. We put the heart here. All the nurses, all the doctors. We are people that are also working on ourselves, not only on professional matter, but we also take care of our mental health. You know, we're people that we know the struggle, and we're here. We walk with them, you know, and sometimes it's hard. People cannot know we're helping because we are not helping them the way they imagine, but we know we are doing something. And people here have the heart, and I trust my team. I know that we are building this with the heart.
With care and
Yes.
heart and soul.
Yes.
One of the protocols I loved that was developed a few years ago was how to give an EKG with love.
Yeah.
I was like, God, if every doctor and nurse in America could have this protocol, so you're not just rushed through EKGs, but to really look someone in the eye, to talk to them about something that matters, like while you're testing their heart, and to really enforce that care at the same time, just that alone could change
a lot on
the medical
medicine
system. So that's really beautiful.
Yeah. And it brings you, I mean, the staff, it brings you to the present, you know? It's not another AKG. It's the AKG for this, you know? It's because he's arriving, because he's going to have a flood dose, because it's going to have the supplementary, because we care. We want to know how your heart is. We need to make sure that you're okay. And this is also a moment to talk to the client, to get to know them a little more. You know, it's opening a space, it's creating a bond, and it's a special moment.
So you mentioned a little bit earlier that the team really cares and the team works together. What sort of activities does the team do together to grow together outside of work?
We have outside of work, you said?
Or inside of here as well. Like,
there's a few. Like,
I only know about a few. Like, I play paddle with you guys every Thursday night, which is really fun. But I'm curious.
Wednesday, the males at Beond have their soccer game. So tonight it's gonna be a soccer game. And I also I went one time, and it was really fun. I just scream a lot, like run, kick it, goal, and things like that. So it's creating also that bond on the team. And also, during work, we have rounds, and it's a moment that we talk to all the team members, like doctors, nurses, coaches, clinical experience. It's
multidisciplinary, so it's people from every different department. There's more than 100 employees here now. Come together. Is it every day?
Yes, every day.
Rounds, and to talk about each specific
client and where we are. If they need the cardiological consult is there, or if they're completing the program and they go, and we talk a little about it was a great experience for the client. Sometimes, especially the client experience, share more about the inside of the clients during. So it's a moment of the team that we collaborate. And if a client arrives with some cardiological changes that we need to change the treatment, it's the moment that we talk about, like, what are the options, what we can do as a team. We create the plan, and then we present to the client, like, we believe this is something that we can offer, and it will be helpful for you. And the client also can say yes or no, or maybe I want this. So as a team, I think we create also that, like, every department matters. Everyone has something important to say and share, and to create this environment for for our guests.
Yeah, every department's coming from their own perspective, the unique lens, the
Yeah.
food and beverage,
Yeah.
they're nourishing through food. They get
Yeah.
to know clients in a certain way.
Yeah.
Versus of course, the therapists and coaches. It's more psychological.
Yeah.
Nurses, medical and psychological. So,
Yeah.
and doctors, of course. So that's really cool that everyone can offer their unique perspective in supporting each
Yeah.
client and sending them off with what they need too.
And also it feels like we're opening a different field on the medicine, on the nursing, like creating, we are doing this from scratch, like building nurses that are not only providing care, but also coaching and also trip sitting and also how to dysregulate a patient or de-escalate, like how to de-escalate a client, how to approach them, doctors, how they do their consult, how we choose our words in order to be understood in the best way possible and to listen, like we are building this new field of the medicine that is changing everything. The way I see my profession, the way I want to be a nurse now. I know if for any reason, sometimes I will go back to the hospital working, I know I will be a different nurse. I know I will know that I have a person on the bed that has a family, have kids, a mother, a father, people that care for them. And it's not only a bed,
Yeah, they're not just an empty shell, which is a lot of, sadly, how the hospitals become. These are real people with lives and people that care about them.
Yeah.
Yeah, deep listening is deep medicine.
Yeah.
Well said. Well, I have a few more questions. So when a family member calls about sending somebody here, let's say the person's already on site and they're afraid, what do you tell them? How do you support them?
We have some of that and we always try to reach out. Normally they have the contact for pre-admission, so pre-admission let us know on the supervision team that someone is asking for an update or they want to know how they are, because sometimes or they are very fully on the experiences here that they forgot the phone or they don't feel quite well. So we always reach out and explain them where we are, how that guest is feeling, and what is the plan. If there is something that we need to encourage them to do, or and also normally the family members let us know what would be helpful. Like what would be helpful in order to take care of that guest.
So more listening, support, guidance, care.
Yes.
I love that. Okay, my closing question is there a guest who really changed you? Don't name their name, of course, but curious how that happened.
Yes, it was, I think, most of the beginning. I was a floor nurse, and we have one guest that he was here for 30-something days. Very challenging client. I was like opening myself to this new way of nursing. and he teach me a lot. It was very challenging at the beginning. I had a breakthrough even with Patty. I was crying and I was like, I'm not good for this. I don't understand. I feel like I'm not good.
What made you question your whole
my
career?
everything,
Wow.
everything. And it was very challenging for myself. But I think that was my biggest step here. Like listening to how I feel also and do something about it, like change it, like I have the power to become better. And that specific client helped me like do that jump here. And there's been a lot of clients that you create a really nice connection, like listening to their stories. And you create like a bond also there. There's a lot of that in a good way, but that specific client that it was very challenging was the one that I think opened the Hilda at Beond.
The challenge gave you the most. That challenge gave you the most growth.
Yes,
there was growth. There was a treasure in the challenge.
Yes, and it was like there was a point that I was like ready to say, I'm not good for this.
You were ready to throw in the towel and
Yeah.
like, I'm done.
Yeah, I was, yeah. And then that was like the hard part, like stay here, do the work for myself, in order for me to have the growth and to show it here.
So you were like at a fork in the road with so many things in life. That's true. We can't see the edge on the other side. If we choose the challenge, if we take the growth, if you go further ahead, what happens? Or you can choose to not do the work. Or so
Correct.
Speaking of that, I guess I lied. One last question. For people that are on the fence, like this is not for everybody.
Yeah.
We don't think it is. You're welcome to talk to our pre-admission team as part of the website, and it's complimentary. But for those that are on the fence who want to do this but aren't certain, what piece of advice would you offer them?
I think for me, it's an honor to participate in people's journey. It's something that we understand is very challenging. Open the inside door of ourselves and take a true look through ourselves. So what I would say is like we are professionals, that we are ready. We have the heart, and to give themselves also the opportunity to jump. Like the only way out is through it. I think it's
the only way out is through.
Yeah. So as I express like my experience on that client, that it was very challenging. I know if I choose differently, I don't know where we will be right now. But I love where we are right now by the choices I made. So jumping and taking that responsibility on myself and to say, I'll keep going. It's something that has given me a lot. So I will invite people to do the jump, to try, to heal.
Thank you so much. It's been an honor to have you on the show, and really grateful for your leadership, to watch you grow, to come, as part of the floor nurse, one of the 30 nurses, and then to move your way up and now be a supervisor here. And just for your wisdom and insight, and gratitude to you for taking the jump.
Thank you for trusting me, for giving me the opportunity to be here. For me, it's also an honor, not only to be in the podcast, but to be part of Beond and what it's making into the world.